what is communication, and how does communication affect the autism disorder? Communication is more complicated than knowing the meaning of words. It takes recognition and understanding of cultural phrases. Autism is a neurological disorder that affects the nervous system. This in turn affects the sensory system, which affects communication. Autistic children find it very difficult to communicate. Research suggests that there are 3 main communication impairments which caretakers need to pay special attention to. They are the speech delay, the inability to speak properly to others, and a repetition of known words. By the age of 2 and a half, most children have learned how to communicate either through words or gestures. This is not so for autistic children. Autistic children may not have the ability to speak, and they might not have the ability to express how they are feeling through words. One main reason for this problem is in the diagram behind me. As you can see, we have many parts of the brain that we use for speaking and communicating. We use these parts of the brain for memory function as well as learning. Research shows that the autistic brain has parts of the brain that are measured smaller than others. They are the trapezoid body, the superior olive, the facial nucleus, and the interior olive. We use these parts of our brain for hearing, for facial expressions, and in controlling our movements. One main reason that autistic children are unable to communicate is confusion. When autistic children are faced with new or unusual information, they become confused. According to Rosenberg, a lead researcher in autism, there are 2 reasons for this confusion: receptive and expressive communication. Receptive communication is how we process what we have heard. Expressive communication is how we express how we are thinking or feeling. Most autistic children have problems with either receptive or expressive communication. People with autism may have aprasia. This is the inability to move the tongue or mouth to speak words. Aprasia is a treatable condition. When aprasia is treated, an autistic child could learn how to form words. There are other impairments in communicating that may not be treatable. Proper etiquette when communicating is not often taught but learned through observing others. According to Rosenberg, again, in the theory of mind explanation of autism, autistic people are unable to think about the thoughts of others. They can be unaware of the people around them and what is proper and improper. For an example, an autistic child may not know that it is improper to ask a woman her age or weight. Ideas that are not concrete or visible in their minds are very difficult for them to understand. When trying to be a part of a conversation, an autistic child may tend to ask unrelated or embarrassing questions. Another tendency autistic children show when trying to be part of a conversation is repetitiveness. Repeating words or phrases is a common problem in the autistic disorder. People with autism do not like change. They feel less confused when their routine is scheduled and repetitive. Their insistence on a repetitive routine can cause a disorder called echolalia. According to Sigmund and Katz, echolalia means a parrot-like echoing. There are 2 types of echolalia, the immediate and the delayed. In the immediate echolalia, an autistic child will repeat exactly what they have just heard, like hello, hello, but they may not know what they are saying. In the delayed echolalia, an autistic child may repeat something they have heard in a past conversation that may not be related to the conversation at hand. According to Sigmund and Katz, 80% of verbally able autistic children develop echolalia. In conclusion, caretakers need to pay special attention to the three main communication impairments in the autistic child. First, caretakers need to remember that autistic children have a speech delay. Secondly, proper etiquette is not often taught but observed. And thirdly, the communication impairment often seen in autistic children is repetition of known phrases. While remembering these main communication impairments, caretakers have the knowledge needed to gently understand and communicate with an autistic child. Are there any questions?
Yes. Are autistic children able to learn?
Yes. Autistic children are able to learn. There is a type of autism called the savant, where an autistic child may excel in one area like math or memorizing. In fact, they may be a genius in this area. But autism will still affect them socially, even though they excel in this one area. Are there any other questions?
Yes. Is there any outward signs of autism?
No. There are no outward deformities or differences in an autistic child. An autistic child will look just like the average child.